Center for
Good evening, everyone. Myself, Dr. Darshan, PG in Community Medicine, ESI Medical College, Rajajinagar. So, we have our topic is air pollution. So, in the given scenario we have taken is a 43-year-old traffic policeman coming to the OPD with the complaints of cough, breathlessness, wheeze, and headache since 1 week. He has a recurrent history of these complaints, and he is a known case of hypertension since 5 years, and his residence is near an industrial area. Then we will see what are the causes for air pollution. Then the causes are mainly unplanned urbanization, industrialization, and deforestation, and combustion of fossil fuels, mainly diesel, petrol, and before we used to have kerosene, and increase in population size, then industrial pollutants such as carbon dioxide, carbon monoxide, sulfur dioxide, and from ACs, refrigerators, we have chlorofluorocarbons. Then forest fires. What is the recent forest fire, you know? I don't know if I got. And burning of mainly solid waste, especially plastic and all, and then crop residue in Punjab, Haryana region, what crop residue they will burn, it will carry to the Delhi area. Then what are the health impacts of air pollution? It will go system wise. It affects all, not only humans, other animals also it will affect. So in animals mainly we will see respiratory. In respiratory system we have various respiratory infections, asthma, COPD, and restrictive lung diseases, and cancers also. Then in coming to the cardiovascular disease system, we have myocardial infarction and hypertension. Then in CNS, central nervous system, we have migraine, Alzheimer's disease, stroke, and cognitive impairment, dementia. And skin, we have acne, eczema, psoriasis, and allergies. In mental health, we have will be having daily when we are driving in the traffic, we will get anxiety, depression, then stress-related disorders, sleep disorders, behavioral changes, and in pregnancy, what will happen is increased incidence of asthma and wheezing in the children who are born to the mothers who are exposed to air pollution. Then low birth weight, in intrauterine growth retardation, and preterm birth and stillbirth. And coming to the cancers, we have cancer of lung and cancer of various other organs, and oral cavity cancer. In the oral health, we have loss of periodontal health and xerostomia and caries. And all these are related to outdoor air pollution. Then comes the indoor air pollution we have. It will be caused due to the dust mites, fungus, various virus, bacteria, and cockroaches. Then in that only will come is the second hand smoke and third hand smoke. Now, how do we deal with the case in this scenario? First, we screen all the persons. First, we screen the industry workers who are exposed to these air pollution. Then, who are people who are living in the area, industrial area, will screen. Then, who are the occupations who are at risk, mainly the traffic policemen, drivers. All these people will screen. Then, we have to treat this. Before treating, we have to diagnose what has happened to them. In diagnosis, starting we have baseline investigations such as X-ray, complete blood count. Then in that only we have sputum culture and pulmonary function tests. And in the higher investigations, we have allergy tests and CT scans. In the treatment part, we have mainly we will treat according to the disease. In this case, if it is a respiratory case, we'll diagnose and treat according to the same. And if it is a respiratory infections or diseases, we'll give corticosteroids and bronchodilators. And antihistaminics. Next we will come into the prevention. We have seen the causes and what are the symptoms and all. Then in prevention we have what we can do at the individual level. At the individual level we have what we can see is we can plant more trees. Then everyone knows Saloni Marda Timmaka, right? Similar to she is done planting of trees. Then we also have to do occasionally at least. Then use of public transport like bus, trains and all. Then using of vehicles which causes less pollution, and we have to reduce the vehicle exhausts. Then at legislation levels we have banning of diesel fuels or use them up to 15 years. And then we should have green belts or green zones around the industrial area. One case study which we have is related to how Reliance Industries became the world's largest exporter of mangoes. So around their oil refinery in Gujarat, they planted mango trees and they became the largest exporter of mangoes. Then Wildlife Protection Act 1972, what sir has told in the morning, Dr. Chandrasekhar sir. Then reserve forests have been built, Bandipura for example, and BR Hills. In that area if you go, even you shouldn't stop the vehicle in that area. And and industrial health. And I am coming from ESI Medical College. We have ESI Act and Factories Act and National Institute of Occupational Health for the health of the occupational workers. And in the end, strong, stable government is necessary to bring about the change in the current air pollution crisis. That is a political commitment. Then we can have can conduct health education sessions, mainly behavioral change communications, and one more speaker told about the include of this curriculum in the schools, school texts and universities. Thank you for everyone.